Chapter 25, Diuretic Drugs. These are drugs that accelerate the rate of urine formation. This results in the removal of sodium and water from the body. So why do we use diuretics? To remove the fluid, to remove excess sodium from the body's system. But what is too much fluid in the body system associated with? Hypertension, edema, whether it be central edema or peripheral edema. In the nephrons, where sodium goes, water follows. If water is not absorbed, it is excreted in the urine. Diuretic drugs come in various classes, the carbonic anhydrase inhibitors, which we're not going to talk about, osmotic diuretics, loop diuretics, potassium-sparing diuretics, and the thiazide and thiazide-like diuretics. Okay, osmotic diuretics. The one that falls into this category is mannitol. Some people call it osmotrol. It is a substance that is given through an IV, and it is non-absorbable. That means you've got an osmotic effect going on. You've got all this extra stuff in the blood that can't be absorbed. The body says, well, we need to thin it out a little, and it pulls fluid from the tissues into the bloodstream and keeps it there. Then it goes to the kidneys where it is excreted. This drug is used for rapid diuresis. It increases the GFR and renal plasma flow, so it helps to prevent kidney damage during acute renal failure. It's used in the treatment of patients in early oliguric phase of renal failure. Sometimes we use it to promote the excretion of toxic substances, kind of flushing the body out. This drug is also used for the reduction of intracranial pressure and the treatment of cerebral edema. This drug is not used to treat peripheral edema. So the puffy hands and feet, nope, we don't go for this drug for that. The cerebral edema, yeah, then we choose this drug. Because it's making things happen rapidly, and it's pulling fluid, especially from the cerebral area, rapidly, sometimes we end up with convulsions. We may also get thrombophlebitis, pulmonary congestion. Pulmonary congestion, we're pulling fluids rapidly from different body tissues into the bloodstream. Well, if your body and your heart can't handle it, it backs up into the lungs, so we get pulmonary congestion. It's also associated with headaches, chest pains, tachycardia, blurred vision, chills, and fever. Now, the osmotic diuretics we're using to treat central edema. All these other ones we're using to treat peripheral edema and to treat hypertension. Now, the hypertension and edema might be associated with heart failure or kidney disease or liver disease, and the edema might be caused as a side effect of other medical treatments. Within this non-osmotic group are loop diuretics, and the drug in this group we're going to focus on is Lasix, or furosemide. It causes an increase in renal prostaglandins and the subsequent dilation of blood vessels and decreased peripheral vascular resistance. It is very good at causing diuresis. It's a strong drug. And it'll cause lots of loss of fluid. You lose lots of fluid, we're worried about losing it too quickly and all the side effects that come from that. What is that? Hypotension. These drugs cause a drop in fluid volume, which will then cause lowered blood pressure, lowered pulmonary resistance, lowered systemic vascular resistance, lowered central venous pressure, left ventricle and end diastolic pressure, but it's also associated with sodium and potassium depletion. Remember, these drugs can cause hypokalemia. Potassium-sparing diuretics, however, don't. And the one in this category we're looking at is spironolactone, also called aldactone. It interferes with the sodium-potassium exchange, blocks the resorption of sodium and water, and causes sodium and water to be excreted, but the potassium stays in the body. So for this one, we could potentially end up with hyperkalemia. The sodium stays, the fluid goes, so you've got a relative increase. There's a concentration of the potassium that is there. Now this drug also has some side effects. Gynecomastia, which is breast development in males, amenorrhea, irregular menses, postmenopausal bleeding. This should trigger something in your brain to say, hey, we got something going on with hormones. This one is messing with some of the hormones in the body. Thiazide and thiazide-like diuretics, that's the hydrochlorothiazide and chlorothiazide. These inhibit the resorption of sodium chloride and potassium ions, meaning that water, sodium, and chloride are excreted. So is potassium, but to a lesser extent. It doesn't cause as much problem with hypokalemia, but it still could. There's a dilation in the arterioles by direct relaxation, lowering the peripheral vascular resistance. And remember, there's a depletion of sodium, water and maybe potassium. With this one, we need to be watching the creatinine clearance, because if it's less than 30 to 50, we shouldn't be using these drugs. Okay, so for all these drugs, except for the osmotic diuretics, in terms of adverse effects, well, we're going to see, I've got it in quotation marks, relative hypotension, relative hypovolemia. That means, we've lost, the blood pressure's gone down and the fluid volume has gone down, and maybe it's gone down faster than the body can adjust. Because of that, we may end up with dizziness, headache, nausea, vomiting, urinary frequency. You're getting rid of fluid, you got to get rid of it, so you got to go to the bathroom all the time. Postural hypotension and dehydration. With some of these, we also end up with hypokalemia. Need to know the signs and symptoms of that one. And the issue there is if they're taking digitalis, they could end up having digitalis toxicity. Some of these drugs also cause hyperglycemia. So people who have or are prone to diabetes may have some trouble with their blood sugar.